I'm Dr. Rob Wilke from Plastic Surgery. In my last video, we talked about the classic facelift procedure. Now I'd like to talk a bit about the mini facelift or modified facelift procedure. The mini facelift is a surgery that has become much more popular in the past 5 years or so. It's a great procedure for people most commonly in the age range of about 50 to early 60s that have some facial droop or laxity and feel that they're looking a little older than they want to look. If someone has a large degree of laxity, especially in the neck, then a more classic facelift is needed, which will better address those concerns. There tends to be some confusion surrounding what a mini facelift really is, and that's partly due to the fact that there have been many different names applied to the procedure. In our practice, we call it either a mini facelift or modified facelift, but it's also sometimes called a short scar facelift, an S-lift, or given proprietary names such as lifestyle lift or a weekend facelift, which implies that it takes just a couple of days of recovery and you're completely back to normal. And this is where we get into problems because some of the practitioners are doing such a minor procedure that they really aren't accomplishing any significant benefits for their patients. Like the old saying, you have to crack a few eggs to make a cake. You still need to do a real surgery to accomplish real results. So at Plastic Surgery, when we do a mini facelift, we're still doing much of the same work that we would do with a classic facelift. The differences are we can get by with a shorter scar, there's a bit less surgical time and less recovery time. But I still tell my patients to expect at least 7 to 10 days of noticeable bruising and swelling, and it will take about 2 weeks to return to relatively full levels of activity. Let me show a couple of diagrams to better explain the procedure.
The first picture shows a classic facelift. The yellow line is the incision, which begins along the temporal hairline and extends around the ear and into the posterior hairline. The shaded area is where we need to undermine or free up the skin widely throughout the cheek and neck. We then do the lifting of the deep tissues. The next picture is a diagram of a mini facelift. The incision is similar in front of the ear, but it ends behind the ear and doesn't need to extend all the way back into the posterior scalp. We free up the cheek fairly aggressively like we would do in a standard classic facelift, but we do much less undermining in the neck. Someone who is a candidate for a mini facelift generally isn't going to have significant neck laxity, so there's really no need to do that more aggressive work. You don't want to do more surgery than someone needs. We then do the deep lift in the SMAS and platysma using suturing techniques, and that's depicted by the black dotted oval-shaped lines on the diagram.
So the mini facelift can be a great option for the right candidate, lessening the scarring, recovery time, and expense of the procedure as compared to a classic facelift. If you're interested in this or any other cosmetic procedure, call Plastic Surgery and schedule a consult with one of us, and we can work on an individualized plan to accomplish your goals.